of course, on Mondays, we love to get into the conversation of all things that have to do with health. And it's so appropriate because it is National Kidney Awareness Week this week. So we want to celebrate it and really understand what it's all about. And that's why we have National Renal Care in the building, with Melissa as well as with Thato, here to talk to us more about kidneys, really understanding the function that kidneys play in our bodies, why they're so important, and what we can do to take care of them. So ladies and gents, welcome to the show, and thank you for joining us. Welcome, welcome. First and foremost, Asqaleni, what does National Renal Care do? What are you guys all about?
All right, can you guys hear me?
Yes, yes.
All right.
A little closer, please. Thank you so much.
So
Yes.
National Renal Care is a wholly South African owned company. It has been established in 1995. The company is in partnership with both public and some private hospital group sector. At National Renal Care, we actually specialize in renal replacement therapy and supportive therapies to enhance the life of patients that is living with the condition, meaning kidney disease. Just to mention a few of the therapies that we are catering at National Renal Care, we are having what we call home hemodialysis, where the patient is actually dialyzed at home. And we also have what we call in-center dialysis, where obviously the client comes to our facility. Currently in South Africa, we've got 75 clinics nationwide. In Western Cape, currently we've got 12. And it is a company that is growing fast because of the demand of obviously the service that is required by the community. And we also do nocturnal, which is night dialysis for patients that is working and unable to attend the clinic during the day.
Okay.
Thank you very much.
And if someone is getting into the conversation, obviously we know that kidneys are part of our bodies. And if you study life science, which you had to, I think at the beginning, everyone knew, like, okay, there are lungs, there's kidneys, there's this, there's that. But what are the functions of kidneys if someone has forgotten? It's like, well, what do I actually really need to know about my kidneys? Do I have to care for them? What is the function of kidneys? You can take it, Melissa. No?
I'll let my colleagues.
Okay, go right ahead.
Just to mention a few, but in a nutshell, the kidney's role in the body, it is to filtrate and to remove excessive fluid and toxin that is created through the body.
Yes.
So once the kidney is not functional, obviously,
Yes.
obviously all of that is compromised in the body, and the body will end up breaking down, and the buildup of toxins in the body is going to take place. So the kidney's role is to regulate electrolytes in the body, such as sodium. It is to aid in the production of red blood cells to prevent anemia. It is to also excrete any toxins in the body.
Yeah.
It also aids in producing hormones, in aiding of bone disease and to prevent conditions such as hypertension. And it also aids as a general fluid removal of the body.
So then it has actually so many functions, more than I actually knew. So then when do you know that your body is in a bit of trouble? What are some of the symptoms that you think you can look out for that are early symptoms to show you that maybe my body's in trouble, I need to go visit a doctor, I need to go to a clinic or my nearest emergency place?
So what we usually advise is that for hypertensives and diabetics, it's important for them to have regular screenings. So symptoms that you would want to look out for, one of which is fatigue. So fatigue is feeling very tired all the time, swelling around the eye area and the feet area as well, and also changes in urination. So you want to, when I say changes, so you're urinating more frequently, your urine looks darker than it's supposed to, and also, so should you experience these symptoms and you are hypertensive and diabetic, also we look at the population who is HIV positive as well. It's important for them as well to do their regular checks. You would go to your doctor and the tests that the doctor would do would be a simple blood test which checks, it's called a creatinine blood test. So that checks for your EGFR, which is estimated glomerular filtration rate. And that helps determine how well your kidneys are actually clearing waste. There's a simple urine test where you urinate in a cup. I'm sure most of us know we've done all of that when you go to your GP.
For sure.
And dipstick, and that helps to pick up whether there's any protein in the urine. If there is, then that's also an indicator of possible kidney damage that is happening.
And over here, we believe in prevention is better than cure. We always tell our viewers, like, you don't want to find out too late. So we really believe in things that we can do to make sure that our bodies are not getting these sicknesses. Obviously, sometimes it's too late. But what can we do to make sure that we're not getting kidney disease, that we're not pushing our bodies beyond the limits that they can take?
So what you want to do, and my colleague can elaborate,
Yes.
you want to make sure that you are leading a healthy lifestyle. So watch your intake of salt. He mentioned sodium. So you don't want to have a diet that is very high in salt. You want to also watch how much of red meat, especially, that you're taking in. Everything in moderation, that's key. You want to also live an active lifestyle. So exercise is important, and minimize stress. It's easy to say, it's hard to do, but try your best to minimize stress. And make sure you get your annual screenings.
Yes, you can elaborate, my brother, just as the last thought.
Just to add a few, it's common things that we tend to really be ignorant of. We as especially the youth, we are common depending on over-the-counter medication, and it really contributes negatively towards your kidneys. Therefore, as Melissa has said, everything needs to be at a limit. So you cannot just go and make use of over-the-counter medication unnecessarily, because it will definitely have an impact on your kidneys on the long term.
Oh my goodness. Thank you guys so much for joining us. Really quickly, where can we find more information? What are your websites?
So you can find us on at National Renal Care, so on our Instagram page, and also the National Renal Care website, www.nrc.co.za.
Thank you guys so much for joining us. Honestly, I feel like I know so much more. Thank you. But of course, we were standing on the other side, really trying to understand what us as CTV has been doing before the 31st of December.